Hello and welcome. My name is Donna Cryer. I am the founder and CEO of the Global Liver Institute, and I have the great privilege of being your host for GLI Live. This episode, if you notice, I might be dressed a little differently, is on the effects of exercise and NASH. And so I thought I'd dress accordingly. I have with me today an expert in this subject, not how to dress for exercise, although I heard he was in a CrossFit shirt earlier. But Dr. Jonathan Stine, who is a friend of the Global Liver Institute and is Director of Research at the Penn State Liver Center. Welcome, Jonathan.
Thanks, Donna. Again, sorry I didn't get the memo about the dress code. Believe me, that would have been more comfortable attire for me, especially during the pandemic when we're all used to wearing a little more relaxed attire and everything. But thank you so much for having me. Looking forward to kicking off our discussion here with National Physical Activity Month upon us.
Yes, absolutely. It's certainly something that we want to promote all year round, but if it gives us an opportunity to talk about the importance of physical activity to everyone, but particularly for patients who have fatty liver disease or NASH, we'll take it, right?
Yeah, absolutely. Anything to get people active is always important.
So at this point in the pandemic, it seems to me that people are in one or two places on their own personal spectrum. They're either in the sort of worst state ever, but an expert in baking sourdough bread, or they are in their best state ever, having stocked their house, as I admittedly have, with every possible piece of equipment that they used to go out and use at the gym. I do admire, though, those folks who have gotten out and hiked and explored, their neighborhoods and national parks, and maybe as the weather improves, I'll do some more of that. But what has been the effect of COVID-19 on people's weight and levels of physical fitness?
Yeah, Donna, I mean, as you alluded to, I mean, the COVID-19 pandemic has really upended life as we know it. And everyone is struggling with how to best meet this challenge head on. And through this crucible, both healthy and unhealthy habits have been born. And maintaining these healthy habits as we get back to business as usual with the reopening of our society is really going to be challenging. For individuals who are able to slow down the pace of their lives or reallocate some of their time in an effort to commit to wellness, including exercising more. The challenge that I see it, moving forward is going to continue this commitment as the pace of our life returns, perhaps to where it was before the pandemic. So, carving out this time for wellness is going to continue to need to be prioritized in order for people's healthy habits, to continue, and ideally look for employers to continue to allow for that. But that's a bigger conversation for sure. On the other hand, for those individuals who are not quite as successful in establishing a healthy lifestyle, during the past 14 months, rest assured you're not alone. There's a recent study from the Journal of the American Medical Association from one of my colleagues, Dr. Anthony Lin, and their team found the average weight gain for Americans was roughly 1.5 pounds each month. So given this is, again, month 14 of the pandemic, most Americans have gained over 20 pounds. And, anecdotally, I'm seeing this in my clinic. I'm really finding people are upset with their weight gain, and they're in this, cycle of self-criticism. So, for those of you who are there, breaking the cycle is highly important. Negative self-talk, it rarely helps anyone with these large-scale behavioral changes. So, I work on this with my patients. Together we set out to design a individualized plan to find out very specific ways we can encourage them to become more physically active. And the conversation, starts with you're doing your best and what do you enjoy? What do you like for activity? Because any activity is good.
I want to pick up on two of the very important points that you made there. One is the opportunity to pause before the great reopening, and I love how you put that, and evaluate, were there things about these past 12 months that were good for your health, that you finally took the time to do. And as you know, making the decision to go back into old routines, really perhaps create new ones and take with you, or even negotiate with your employer. And I say that as an employer, negotiate, the time or the space or the opportunities to keep some of these wellness activities. Ultimately it'll make you a healthier person, a happier, teammate and colleague and employee. And so I would hope that, every employer would encourage that pause and rethinking, so that we're not going back, but really moving forward in a healthier, more balanced way.
Yeah, I mean, I couldn't agree, more wholeheartedly with, everything that you said there. I think, on a personal level, I was able to reflect more on, both healthy and unhealthy behaviors, and kind of figure out, where I'm directing my energy, towards. And, perhaps as a, busy physician with an active research laboratory, a busy clinical practice, leadership positions, many times you move forward in those avenues and you kind of forget about yourself, and, prioritizing that self-care. So, I've kind of taken that experience, to my patients, and, try to be an advocate for them, doing the same thing. And I found a lot of people have really enjoyed this opportunity. They've picked up new hobbies they've never had before. Gardening is very big amongst a lot of my patients. Even, getting, dogs and going out and walking. And, not all has been bad in the past 14 months. I think this wellness conversation is evolving, and, certainly it's an opportunity to, go to your employer, go to your boss and say, hey, these are the things that work for me. My mental and physical health is better, or my mental and physical health is worse. And this is what I need to be healthy. And then I can in turn be as productive as possible, moving forward, which ultimately benefits, everyone in this endeavor.
We knew that before the pandemic that there was a large portion of the population with fatty liver disease and NASH who were in that 45 to 54 working age population. And that's still true. So often it had been depicted as just something that, develops over such a long period of time that it's only, 65 plus, but that's not the case of it. And then we've seen not only adults, but children who have added a lot of weight during this pandemic, and the rates of pediatric NASH have grown. And so, movement for and exercise for the whole family is really something that's important, and that not only individual families, but schools and communities need to support as well.
Yeah, completely agree. Again, it's it starts at the top, at least, with kids and with schools, and setting the example yourself. And families that move together ultimately can make healthier choices, and then you're training the next generation. My patients who are kind of that sandwich generation in their 40s and 50s, where they have younger children on one end, and then perhaps parents on the other end who require additional attention, and they've really been squeezed by the pandemic. And in my opinion, in fact, there's been even less time for working parents who many times have been running school from home, or having additional supervision and additional work responsibilities. So just anecdotally, I found this group of my patients to struggle the most with how to prioritize self-care during the pandemic. And I think anything we can work on for that group of people is very important moving forward, for sure.
So the American College of Sports Medicine has an initiative to help people. Can you talk to us about that?
Yeah, so the American College of Sports Medicine has long been a leader in the field of research, and exercise research in particular, and taking this research from the bench to the bedside, with the goal of improving the clinical care and the health of really everyone. And way back in 2007, the Exercise as Medicine initiative was launched, and this is really a global health initiative designed to make physical activity assessment and promotion a standard in all clinical care. And the ACSM provides evidence-based resources for everyone. And, as this movement has grown, so too have the number of diseases where we can prescribe exercise as medicine, similar to a drug, in order to treat and improve chronic disease. And, there are currently 30 diseases now covered under the Exercise as Medicine initiative, including, my area of interest and expertise, non-alcoholic fatty liver disease.
And we thank you for that. So often liver diseases are left out of the conversation. And so we really appreciate being at the center of that conversation, along with our friends with the obesity and diabetes and hypertension, because they're often found together in the same person, the same patient. And so addressing them with the same prescription, I think is really helpful from an individual perspective and a public health perspective as well.
Yeah, I absolutely agree. In particular for fatty liver disease, where there's no effective drug treatment or cure really, and we really have to double down on this healthy lifestyle with increased amounts of activity, as the cornerstone of what we use to improve the lives and the care of our patients. So, again, any activity is good, but there are specifics that the Exercise as Medicine initiative prescribes to help guide patients with fatty liver disease and comorbid conditions such as diabetes or obesity in order to be effective and successful in their exercise and fitness goals.
So tell us more about that, because I hear from so many NASH patients that they're just told lose weight, and if they're told specifically lose 7 to 10% of their body weight to affect their NASH, their disease, they're still not left with many more specifics or instructions or guidance. And so tell us more about what the people living with NASH really need to do in terms of the type of exercise that would be most helpful for them.
Yeah, I mean, I think that's a really important question. And too often in the clinic, we just we gloss over it, and we just, like you said, say, go lose weight. We know that if our patients with fatty liver disease lose 5% of their body weight, that's enough to, remove fat from the liver. And then again, if they lose even more weight, 7 to 10%, we can reverse the fibrosis or the scar tissue. With that being said, there are actually weight loss independent benefits to activity. So, our patients don't even have to lose a single pound, and exercise can still shrink the amount of fat in the liver. It can improve the health of the blood vessels, where they dilate and constrict much more efficiently, and they're less likely to get blockages. It increases physical fitness, and then exercise can lead to favorable changes in our body composition, where we lose body fat and we gain lean muscle mass. So, in order to get these weight loss independent benefits, to me, weight loss is just a cherry on the ice cream sundae, right? So it's
eating, or maybe once in a while.
Exactly, it's a treat. But the weight loss will come. But in order to get to that physical activity goal, the American College of Sports Medicine, through the Exercise as Medicine prescription, recommends that patients with non-alcoholic fatty liver disease try to get at least 150 minutes per week of moderate intensity aerobic exercise. So, you don't have to go run a triathlon. You don't have to sign up for anything that's going to require hours and hours. It's, just go out for a brisk walk. Take your dog, take your friend. If you enjoy light cycling, even a short, spin on the bike. And, every time you do this, we recommend you do it 3 to 5 times a week. And each session, should last 20 to 60 minutes. And if you're able to achieve this, go ahead.
I was going to say, thanks for doing the math there, because there were a lot of people who were like, oh my gosh, 150 minutes, that sounds like a lot. How many minutes are in a week? So thanks for doing the math for everyone and breaking it down, maybe 30 minutes a day, 5 days a week, something, and it's doable, and you can even break those chunks down. But it is sort of the moderate sort of plus intensity that you want to get to. You want to raise your heart rate and things like that. Right?
Yeah. And an important, point you brought up, you can piece it together. For example, if you, walk 10 minutes of that moderate intensity before, going to work, 10 minutes over your lunch break, and then prioritize 10 minutes after work, you've met, your 30 minutes of activity. and are getting closer and closer to that 150 minutes, per week. In addition, the Exercise as Medicine Initiative, does also recommend that patients with fatty liver disease perform some form of resistance training.
Mm-hmm.
And, we want to do this, 2 to 3 times a week.
I keep my weights in my office. I do.
Yeah, it goes with your outfit. That's good.
Thank you. But they do have a place over there on that bookshelf. So in case I am sort of stuck up here in Zoom purgatory, I do turn the camera off from time to time, and we'll do and we'll lift just to make sure that the whole day doesn't go without me getting that in. So
yeah, I think that's a really, having them handy, there in the office is super important, for health. And just remember, ACSM says target every major muscle group just with one exercise. Mm-hmm. So it's bicep curls for your biceps, or chest press. But again, you don't even have to use weights. So
right,
if you have access to exercise bands, you got me excited. I'm ready to go work out. Or even body weight exercises are important. So
that's dependent on if I've vacuumed here, because I do have enough space to do a plank or push up, or a burpee if it's a really great day and nobody's counting on me to speak during the meeting. But I have listened to a lot of podcasts and knocked out a 10-minute high interval, high intensity interval training session here. So
yeah, I have a yoga mat in my office that's ready to enroll, so that way I don't have to do any vacuuming. That's not my strong suit.
But I think it's important, and it's one of the things that I do share with my team as a leader, how I do fit in fitness, and share with other patients. Even aspirations for being fit, as someone who, remembers being, 83 pounds in intensive care, I have more muscle right now than I weighed, before my transplant. And I'm so grateful for that. And so having the privilege to move, is just that. It's a privilege. I think about, I get to exercise, because there's so many days I was just lying in bed, and not able to move, too weak to move. And so to get to exercise, sometimes people feel like it's a burden. No, I have to exercise. Oh my gosh, I need to reach these 150 minutes. What is my doctor talking about or asking about? But if you can, if you can move, it's such a great privilege to be able to move. So that's how I think about it. But logistically, in a busy day, taking the time to figure out how are you gonna fit it in. Where is that time gonna come? I mean, you still have the energy for it, let alone when I open the door and there are dogs or husbands or family or people who also want my attention. And so I think that's important to share. And I also think, for people who have come with me on my, hair journey over the pandemic, part of it is, a lot of, I think the research shows that the population in the US that works out the least are African-American women. And some of that has to do with our hair. And so if I had a choice about, my hips or my hair, I chose, to let my hair go natural, to make it easier for me to, sweat it out every day and come back, and come back to work. And so I think, those are the things that we need to talk about, how we actually make it work for us and how we, fit something this important into our day and into our lives so that we can have lives.
Yeah, I think number one, again, thanks for sharing your journey and everything, and kind of your personal story about how you were able to make these changes and improve health. And it's so oftentimes when we lose things, we gain that perspective. And it's unfortunate some of the circumstances that give us that opportunity. But I dare say that the pandemic would be an opportunity, for this, and to encourage a bigger societal conversation, and one that is, culturally sensitive, and looks into barriers for different groups of people, whether it's men, women, Black, women in particular, as you're talking about. I think it's really important to have these conversations, and there may just be things we're not thinking about as we work to encourage activity. So cultural sensitivity, and making sure that things are equitable, and having these bigger conversations such as we're starting today are very, very important.
Right. I get really excited where I see, there are groups, Black Girls Run, because we do, maybe meet, not me on these knees, I do dance, and ride, but I do swim, and I think it's important that encouraging African Americans in swimming is something that's been important, and is often one of the things that people think Black people don't do, but we do. And this whole, health and culture around, access to playgrounds, to safe spaces, to equipment and sports that are affordable and accessible to everyone is an important part of this equation and conversation. It's no use getting people individually activated with no place for them, to go. And so whether it's showing them things that they can do in their own homes with just body weight or jugs of water, or cans of food, or making sure that there are pools that are available, and playgrounds and running tracks and things like that, I think is important as we think about how are we going to fully address NASH for 1 in 4 people in the United States and in the world. It's really going to need to be a community solution, a public health solution, to enable people to do all the things that they'll need to do to walk back from this precipice of disease. And so I love that your research is helping us advocate for that better. I also want, since I did, I didn't mean to go there, but you inspire me. Talk about my own story in transplantation. Unfortunately, if NASH and other diseases do progress, they can lead to liver cancer or the need for transplant. And NASH is quickly becoming the #1 need for transplant in the country, and yet we don't supply enough organs for the just under 12,000 people who are currently waiting for a liver transplant. So what types of things, you're well published and well known as an advocate of donation and transplantation, what should we be doing?
Yeah. So again, thanks for sharing your story, as we talked about before. And liver transplantation is another totally different, almost lightning rod topic. And the current system, frankly, is failing many of our patients. And as you mentioned, there's a tremendous organ deficit between the amount of transplants we can do every year and the number of people on the waiting list. And we're expecting this to continue to increase as NASH becomes more and more common. And certainly the weight gain wave and tsunami, of some have called it, coming with the pandemic, is going to accelerate this public health burden from fatty liver disease. And over time, we have continued to tinker with the liver allocation system, which is how we prioritize the scarce resource of a liver that is donated, in order to make sure that we're able to transplant the largest number of people. But really, that has only moved the needle so far, and we still have this this large deficit. So ways for us to improve rates of donation include considering an opt-out policy. So for example, when somebody registers for a driver's license, they'd have to check a box that says, I do not want to be an organ donor, and certainly that comes with many thoughts and considerations. But that's one way to increase the amount of people willing, to donate. Number two,
isn't it true that most of Europe operates on an opt-out system?
Yes.
So keep going.
I think that we could certainly model that after others who have been successful in those endeavors. The second thing is, we're currently, working on how to make the organizations, that work locally for organ procurement, called the Organ Procurement Organizations, or OPOs. How do we help support them in, increasing rates of not only successful donation, but conversion, where we then take that organ that was donated and we're able to give it, to a recipient. And there are many different, regional, differences, not only within the OPOs, but also the liver transplant centers. So, trying to, standardize things and remove some of the regional, variability are other ways we're trying to help, reinvigorate the liver transplant, system in this country. And another thing, there's emerging technologies such as machine perfusion devices, which will then allow us to take a organ that comes from a donor, which we may not use because it's considered a marginal liver, or one that, if we were to give it to a recipient, would have significant problems and may ultimately fail relatively quickly. So, with some of this, new technology that's out there, which is incredibly sophisticated, we're hoping that perhaps that will allow us to have even more organs available for our patients. But we could spend another entire GLI live session on this discussion and beyond that, in particular with this topic, for sure.
But you are always welcome back. I think we should have as a goal to eliminate the waiting list for liver transplants through all of the mechanisms that you shared, and more that we work on collaboratively together. It has been a great outcome from at least initial outcome from the House Oversight and Reform Committee, in which one of our colleagues of mine testified that not only did we get an immediate influx of people saying, I'm going to sign my donor card, or I'm going to express my intent to donate, or have the conversation with my family, but we've been able to follow up with the organ procurement organizations who did break off in favor of forming a new innovation alliance around better standards and helping each other just improve, which is what we wanted. We wanted just everybody to work a little bit harder, a little bit smarter, a little bit better, and have the data transparently to show for it, so that we can all work together and that's certainly what drives me. For every patient who hasn't yet been blessed with the miracle of transplantation as I have, to make sure that they ultimately get that opportunity. And I thank you for your partnership in that.
Oh yeah, you're welcome. And again, we appreciate your advocacy and your work as helping every one of my individual patients. And I think we're all striving for the same goal, which is an equal and fair system where everyone has the same opportunity. No matter who you are, no matter where you're from, no matter your background, and everybody has the same chance for this life-saving intervention. And again, I think having these collaborative discussions and focusing on the teamwork aspect and taking the organizations that are high performing and are a little more successful in terms of the number of transplants they're able to move forward with, and allowing them to share their story and their experience, and perhaps not reinventing the wheel, but just strengthening some of the programming and infrastructure that's already in place is certainly one way to move this forward quickly.
Excellent. And I just want to bring this back around to the and tie this into the topic today. If fewer people had NASH or progressed from fatty liver disease to NASH, through exercise, through diet, through lifestyle changes, not only would fewer people need transplants from NASH, but also there would be more people who would be able to donate as living donors. because sometimes people, go in and unfortunately they would like to donate for a loved one, but they find out they have fatty liver disease themselves, and can't donate. And so I think for both parts of this sort of transplant equation, addressing fatty liver disease and NASH with exercise and every other tool in the toolbox that we currently have, and until we develop some more, is so essential.
Yeah, I mean, Donna, you sound like you're writing my next research grant. I may get you on retainer to help with that. But, in all honesty, this is a tremendous public health problem, as you alluded to, one in four American adults. And, anything we can do on the front end that is, preventative, rather than being reactionary on the back end. I can't tell you the number of times, I've had the conversation where somebody's in the hospital, they have a new diagnosis of cirrhosis, they're really sick, and they've never heard of fatty liver disease. They've never heard of cirrhosis outside of alcohol use. And then I come in the room and I say, you need a liver transplant to save your life. So they go from 0 to, well beyond 60 in terms of where their life is headed. And, perhaps we could have, met this a little bit earlier with some, healthier, lifestyle choices. And, not to imply that this is a self-inflicted disease, because there are many different, inputs, but, we do know that physical activity, remains the main way, in combination, with diet, in order to help, put the brakes on this process, or even reverse it. So, moving forward, both from a research and clinical standpoint, and public health, to, have the infrastructure, have the resources, have the buy-in ahead of time is very important. In medicine, we're so often reactionary. We're so disease focused. We're not quite as health focused. And I think the folks at the National Institutes of Health have recognized this, more and more in the recent years. And there are more and more grants and opportunities to study how can we intervene early, how can we be effective, at multiple levels of society, not just the individual, not just the group, but the overall community. And again, I think more to come on this story, but there's certainly buy-in, and I think people are realizing more and more just how important movement is for this particularly common chronic liver disease.
I think that's fantastic, and GLI has been successful in helping to get several large grants funded from the National Cancer Institute, from PCORI, and so we'd love to work with you. And if that's like the little known takeaway fact that GLI's role in research, then this episode, I think, maybe have additional added value than we thought. But it's had so much with you today as our guest, Jonathan, and you are always invited back. And I thank you for today. And for more information for this episode, other episodes, you can go to globalliver.org and find us on Instagram and Twitter and Facebook and everywhere you look on social media. Thank you.
Thanks for having me, Don. I appreciate it. And next time I'll wear a different fitness shirt or something.
Awesome. I love it.